Hi, I'm Jennifer Penrose, owner of Penrose Physical Therapy, and I just wanted to talk to you about osteoporosis. So if you've been given the diagnosis of osteopenia or osteoporosis, that term, I think, leads people to wonder, what do I do now? I've been told by my doctor and my bone scan that I have soft bone or softening bone, and I'm worried about fractures or falling and getting a fracture, and my doctor tells me I need to increase my bone strength and do weight-bearing exercises and resistance exercises. But what really can I do with this this term? And so I just wanted to highlight a couple things with that diagnosis. So osteoporosis affects 60% of Americans over the age of 55. And it's something that can be kind of silent. So there are some things that you need to pay attention to if you are shrinking in height. So it's actually not normal to shrink. A little bit is okay, but you should, in terms of your height loss overall, should not be more than 4 centimeters or about 1.6 inches. So whatever height you achieved the highest in your growing years, you never want to see that go to 1.6 inches or more. That could indicate potentially that you have a compression fracture in your spine. Or every year when you get your height measured, you don't want to see more than a half an inch of height loss. That also should concern you and bring that up with your doctor. So those are some things to track on your own and be your own advocate for. The bones, osteoporosis is different than osteoarthritis. Osteoporosis is the softening of the bone and it starts to collapse. So you start to see this kind of rounding posture start to happen over time. I'm being a little bit dramatic here. Osteoarthritis is arthritis where bone stirs start to happen and there's narrowing of the space where the nerves come out, and that's different than osteoporosis, not the same animal at all. So the softening of the bone that puts you at risk for fractures, and you need to keep track of your height loss. And the other thing would be to make sure you're getting enough calcium and vitamin D. And the third thing is exercise. You want to be very careful about what kind of exercise, because if you do things that are too impactful, you could create a fracture, but you want enough impact to stimulate bone density. And that's really where a specialist who works with people with osteoporosis can be very, very helpful of what exercises to do in the gym and what exercises to stay away from. So there's definitely things you need to apply when you're in a class. So let's say you're doing a yoga class. There are certainly certain movements and positions that could compromise your softened bone structure, but yet there's still a lot you can do. And so I don't want people to be fearful that they can't move, but they need to learn how to move. And that's what coming to someone who works with this population would do for you. And that's something that I work with people all the time on, of how to bend over, because basically your physician will tell you, don't bend over at all, don't twist at all. Well, we still need to function in this world of how to empty the dishwasher or get our socks and shoes on. So there's ways to do that would protect your spine, and you need to just start thinking about how often you bend and how to bend with your hips. And if you have trouble or knee pain, coming and seeing an expert to learn how to do that and problem solve that with you, that is what I'm here for. So kind of start thinking about that process. And also when you exercise, that you're not doing movements that would really bend the spine more. You would want to stay away from those. And I've had patients just bring in their list of exercises that they like to do, or let's walk through your yoga program that you like to attend, and I modify it and explain which ones we can do and which ones we can't with this particular diagnosis. So that way you can move confidently and still participate in your yoga class, your Pilates class. You can function in your home without risk. And then the other topic is just other things around the house that would also help you increase bone density just with daily life. So wearing a weighted vest and figuring out how much weight can I wear, how long should I wear it. Those are based on research studies that show increased bone density, and I'd be happy to help guide you through that process. So if you have this diagnosis, please don't be discouraged. There are resources and tips and ways to guide you through it so that you can be successful and mobile. So please reach out, Penrose Physical Therapy, and I have a free tips report on some additional tips and postures for people who have low bone density. And I'm happy to answer more questions. So please reach out to me as a resource.